Hi guys, in my previous video I showed you the flexion of the arm at the shoulder joint. During the flexion of the arm at the shoulder joint, we also have the lateral rotation of the scapula at the, if you look at here to the inferior angle of the scapula. During the flexion of the arm at the shoulder joint, scapula also rotates laterally like this. So the reason behind is that I discussed in my previous video is that it's repositioning this, and this repositioning provides the great range of motion during the flexion of the shoulder joint. Now I'm going to focus on the extension. So during the extension, the scapula rotates medially like this. So this is the extension, means that the arm moving backwards during the extension and the scapula moving medially or turning medially. Extension, simultaneously we have medial rotation. So which muscles are involving in extension of the arm? So I'm going to show you on the plastic model. Here we have a plastic model. And you can see from the posterior view, we have some muscles. Look at here. We have the deltoid. This is the deltoid. Deltoid has three parts: anterior, middle, and posterior part. We also have some big muscles here. It is known as the teres major. We also have a wide muscle coming from the spine. It's called the Latissimus Dorsi. From the anterior view, you can see this shiny white color tendon of the Latissimus dorsi. You can see the teres major and Latissimus dorsi, they attach to the humerus. And here is the deltoid. So these three muscles, as they are crossing the shoulder joint posteriorly, when they contract, they can do extension. Actually, this muscle also helps them. This is the long head of triceps. Tri means three. It has three heads. This is the long head. Here we have the medial head, and this is the lateral head. So as you see here, the long head going further up and attaching to the infraglenoid tubercle of the scapula. So it attaches here. This is the glenoid cavity. Infraglenoid is here. So the long head of triceps, this one attaches here. And it also helps the posterior deltoid, teres major, and lat dorsi to do extension of the arm at the shoulder joint. So during the extension of the arm at the shoulder joint, as I mentioned earlier, the scapula moving or turning medially, it is known as the medial rotation of the scapula or inward rotation. So which muscles do medial rotation? In my previous video, I showed you these muscles. The muscles that are attaching to the medial border of the scapula, so they are coming from the spine. So imagine that this is my right arm. So this is the spine. So we have some muscles coming from the cervical vertebra. It's called the levator scapulae. We have rhomboid minor. It attaches to the root of the spine of the scapula here. And then we have rhomboid major. So rhomboid major, rhomboid minor, and levator scapula, a group of three muscles. They are coming from the vertebra and they attach to the medial border. So during the extension, all these three muscles contract and do medial rotation of the scapula. We also have some muscles that are actually stabilizing the shoulder joint during the extension. If you look at here, the head of the humerus is 3 times larger than this shallow glenoid cavity. So they make the shoulder joint. During the flexion, the head of the humerus during the extension, the head of the humerus tends to glide posteriorly because the muscles like posterior deltoid and also lat dorsi teres major, they are crossing the shoulder joint posteriorly. As I showed you, when they contract, they do extension. So they are pulling the head of the humerus back. So the head of the humerus tends to glide posteriorly. So we have some rotator cuff muscles, anterior rotator cuff muscles here. Subscapularis. It's coming from the subscapular fossa of the scapula, and it crosses the shoulder joint anteriorly and attached to the lesser tubercle of scapula here, the humerus. So when it contracts, it prevents the head of the humerus from gliding posteriorly during the extension. So I can show you the subscapularis muscle. So again, you can see the scapula from the anterior view. Here is the subscapularis, multi-pennate, strong muscle covering the subscapular fossa. It is known as the subscapularis. And as you see here, it attaches to the lesser tubercle of the humerus. It's crossing the shoulder joint anteriorly. So during the extension of the shoulder joint, posterior deltoid, teres major, long head of triceps, and lat dorsi, they contract to do extension. And opposite to these muscles, we have subscapularis, the anterior rotator cuff muscle. It contracts and stabilizes the shoulder joint. And it keeps the head of the humerus at the center of the glenoid cavity and prevent it from gliding posteriorly. So, as a quick wrap up, during the extension of the humerus or arm at the shoulder joint, we have some muscles that are crossing the shoulder joint posteriorly. We have the posterior deltoid here, and we have the lat dorsi teres major, long head of triceps. They do extension of the humerus at the shoulder joint. At the same time, we have some muscles doing medial rotation of the scapula. A group of three, we have Levator Scapulae, rhomboid minor and rhomboid major. They do medial rotation of the scapula. We also have subscapularis as a stabilizer and prevent the head of the humerus from gliding posteriorly. Thank you so much for it.